Good evening, Devo. I want to thank you for coming to Balance Orlando this Monday evening. And before we get started, all Rolfers and structural integrators will do a medical intake form and listen to your story as to why you decided to come back after 10 years. And you could also tell me what's happening in your body in terms of what's working well and where there are some challenges in your body.
Sure. So I got Rolf by Lou 10 years ago, and I haven't actually gotten any regular body work for the last couple of years. And I started a new job about a year and a half ago, spending a lot more time sitting down at the desk and a lot more time sitting down in the car. And it's a stick shift, and there's traffic. So I'm feeling some issues in my left foot where I'm using the clutch a lot. Um, I'm feeling some issues in my right sciatic area and my sort of around the bra line of my back area, which were some of the problems I had before. And I could, after getting Rolfed, I could self-correct, but I'm finding it more difficult to do that. I find myself getting into these old habits, kicking my foot out to the right when it should be pointing forward and things like that. So I thought it would be a really good idea to remind my body where it needs to be in space, and to get the Rolfing series done again. So.
All right, thank you. Can you tell me of any past surgeries, any past
Oh,
broken bones or
yeah.
sprains?
Well, I did break these two little toes on this foot, and but that was, I mean, that I recovered quickly. I had a surgery on my left knee when I was about 9 years old to remove a calcium deposit, and I don't remember how long that took, but I was in a wheelchair, then in crutches, then limping with a brace for a while, and then that's pretty much it.
Okay. You mentioned before that there was some pain presently in the area around your bra strap. Was that the right or left side or
A
both?
little bit to the right.
Okay.
Yeah, it's all on the right side, and also feels kind of tight in that area, and that was traditionally my problem area. So.
Okay. So what we're going to do now is to come up from the table and we will walk twice to the door and back. And I'm going to look at your movement, look at your Achilles tendons, look at the contralateral motion in your shoulders as you walk.
And I have to try to walk normally while you're watching me.
Yes,
Okay.
at normal pace.
Nice.
Good. I like the shoulder swing.
Thank
I like the way the Achilles tendons are pointing forward as you walk. Excellent. And you're walking in a sagittal plane.
you.
So that's the plane that connects left to right. Sometimes the knees might slightly go over that
Oh
imaginary
wow.
line,
Okay. Huh.
but I was palpating your body before, especially around the calcium
Mm-hmm.
area, and noticed that there was some tension,
Yeah.
not only on the left side, but the right side. And this is something that we'll address for the next session.
Okay.
So let's get on the table, face up, and let's begin.
All right.
When she was walking, which side of the body to work on first. And I noticed that I need to work on the left side first. So let's come over to that side and begin.
So before you get started, I want to make sure you know that I can be a little bit ticklish, so don't worry if I laugh. If I'm not shy about telling you if something's actually uncomfortable, I will let you know. Okay?
Okay,
All
thank you
right.
for telling me. Let me ask you, would you prefer something underneath your knees?
Yeah, that usually feels a little bit better.
Okay, and I thank you.
Maybe I should let you do the work.
Okay, so one of the major goals for Rolf Session 1 is to liberate the shoulders, liberate the arms from the spine so we can get our most potential out of our breath, both in the inhale and exhale. So, what I'm going to do today is to lengthen the arms, which will give us longer muscles from the neck to the shoulder. I'm going to gently pull the fascia, the connective tissue, from the sternum and also from the spine on the inhale and exhale. And I'm also going to work underneath your rib because many people tend to take 1, 2, or 3 breaths. And what I want is a nice, smooth breath. And sometimes the breath will get caught up right in that rib.
Excuse me. That's where I'll be very ticklish.
Okay. So I'm going to take your arm here. And so I like to say my touch is like a submarine that goes forward only until it gets to the bottom of the sea. So I went all the way down to the level of your fascia.
Yep, I can feel it. That's the amazing thing about it is I can really feel the stuff moving, you know?
So again, we want to lengthen the arm so that the shoulders can drop a little bit so we can have longer muscles from our neck to our shoulder. And so far, the fascia feels very accessible.
Yeah, I think I'm, for all the stuff that I'm dealing with, I think I'm far better off than if I had never been Rolfed before.
Do you ever get sore in your wrists during the day or after work?
This wrist, my right wrist, so I'm right-handed. This is my texting thumb, you know,
Yes.
my mouse hand. This wrist tends to feel weak. When I work out, when I do push-ups, I actually use dumbbells and hold onto the dumbbells rather than putting my wrist flat on the ground. And sometimes this wrist gets sore.
Okay. What I like to do is to work both the front and the back side of the forearm because typically where there's tightness on one side of the body shows up in the balancing muscles on the opposite side. So Dr. Rolf used to say, take the tissue where it needs to go and call for movement. And one thing I like about your arm, Debo, is that we don't have excessive pronation or supination. We're right where we need to be. And I'm going to ask you to gently extend your fingers twice. And I'd like you to tell me if there's any soreness or discomfort or pain as you come back and extend one more time. If there's more tightness in your palm, on your finger side, or your little pinky side.
Can I do it one more time?
Sure. And fully extend the fingers.
It's a little bit tender where you're pressing on the thumb side.
Okay.
And it was a little bit tight when I closed my fingers on the back side of my fingers, but I actually don't feel a lot. It doesn't feel like a lot of problem in that area.
Since I know you do a lot of driving and a lot of texting and a lot of computer work, many of my clients have pain and discomfort in their wrists. So what I want to do is remove any fascial adhesions in the wrist.
I actually try to use my left hand more because it's the right one that I definitely feel that stuff in. So I'm trying to even it out a little bit. But also, you know, I can't move the gear shift. I mean, that's on my right side. I can't move the mouse because I'm right-handed.
So what I'm feeling right now is that the fascia is responding well to my firm touch through movement. There are no hot spots in your arm.
Feels really good.
Again, I'm just thinking about length.
Yep. But I mean, I can feel the stuff moving and what I like about Rolfing is it's really deep pressure, but it's like it's not pokey. It's like a consistent kind of smooth pressure.
And just a couple more times. And so now I'm going to place my thumbs on your palm, and I want you to gently ball up your fist and extend twice your fingers. Good. And come on back and tell me if there's still a lot of pain or reduced pain.
That's almost none.
Good. So since there's more pain in the palm by her thumb, I wanted to go and follow that line to the elbow. So I'm going to go back and do another test on the forearm. And what I'm feeling is that it's easier for me to sink into Debo's connective tissue as I go down to her wrist.
Yeah, it feels different than before. Before I could feel the stuff sort of moving under you, and it feels like the same amount of pressure, but I mean, before it felt, I don't know, you know how to describe fascia, it felt almost crinkly underneath, and now it feels smooth.
Thank you. And now I'm just working at the shoulder joint, and I'm following the space between your bicep and tricep, just doing like a mission to determine if there are any fascial adhesions or if that path I'm taking between the bicep and tricep is smooth. My goal, my intention here is to kind of my goal is to almost like melt the fascial adhesions between the bicep and the tricep. By doing this, we get more efficient use of the muscles and an easier time to elongate and contract the muscles of your arm. Now, the next thing I'm going to do is to work both on your back and front.
Okay.
And the idea is to give you a little bit more expansion in your chest. So let's begin. So right now I'm at Debo's spine, kind of like between T5 and T6. And then my fingers will be right at her sternum. And I'm going to ask Debo to take a nice deep inhale. And when she does, I'm going to work on the cartilage between her ribs. And as she exhales, I'm going to take my hand in the back and pull it towards me. And I want you to take a nice deep breath again. And exhale. And Debo, can you tell me if there's any pain or discomfort as I work on your sternum when you're inhaling?
There's no discomfort. I can feel that there's some soreness that you're working on, but it's not, it's not bad.
Okay. Let's take another inhale. And exhale.
It's like on a scale, it would be a 1.
Okay. And 2 more breaths. And exhale. This last time, my pressure will be right at the clavicle, right underneath. So Debo's going to take a nice inhale. And while she's exhaling, I'm at the upper part of the rhomboids and at the distal attachment of the levator scapula. So now we're going to strictly work with the exhale. So Debo's going to take a nice inhale. Good. And exhale. And inhale. And exhale. 2 more times.
I have a mole on my back
Yeah.
there. I want to make sure that you don't like run over it too. You know,
Okay.
it's one of the kinds that sticks out a little bit. So,
Thank you. Thank you for telling me. And exhale. Good. And last time. Inhale. And exhale. Now, since I'm in this position and I have access to the rhomboids, what I see, I feel it right here.
yeah.
Thank you. My hand is right on the rhomboid, and the purpose of the rhomboid is to retract the scapula. We do that typically when we do a jumping jack. So I'm going to take Deborah's hand, and she's going to take a nice inhale, and I'm going to apply some firm pressure with my hands underneath her rhomboid and do some Rolf movement. So inhale, good, and exhale. 2 more times. Inhale, good, and exhale. And so far, I don't feel or see any hitches when I take Devil's arm to about 70 degrees. So since we've worked with the back, I'm now going to work with the front. I'm going to work primarily on your sternum, and we're going to do a snow angel or sand angel. Let me ask where you're from originally.
Florida since I was 2.
Okay, so let's do a sand angel.
Okay.
So we're going to start like where you are with your palm up towards the ceiling, and you're going to slowly go just with the left hand to right here, and you're going to come back. And so my goal is to work in between the ribs and kind of melt the cartilage between the ribs. Okay, so I'm going to have you take a nice inhale and slowly make a snow angel. Now you might feel, there you go, some discomfort, and come on back. And again. A little bit right there.
It just feels like good pressure.
Okay.
I mean,
So far it's very smooth. Good. And come back. I like how there are no hitches in your movement while you take your hand towards your shoulder. Good. And come on back.
Moving. So good.
And last time, right underneath your clavicle. Good. And come on back down. I'm going to let you take a couple of deep breaths.
While I take deep breaths, can I get a blanket for my legs?
You certainly can. So the next thing I'm going to work on is the Pectoralis Minor, which is right underneath your rib cage, and this can be very unusual for many people who have not been massaged there. A lot of people who drive tend to have more medially rotated shoulders, and it will show up in the shortening of the fibers of the Pectoralis Minor. So I know you're ticklish.
Yep, you just keep doing it though. I mean, if it's too bad, I'll tell you.
But what I like is that it's easy to access. There's a little space where the latissimus attaches to the armpit. And so we're just doing some very gentle movement, and I can feel more than anything else if there are any restrictions in your movement. So far, this is not the case.
I think you're going to find a very different story on the right side.
Okay. Take a breath, and now I'm going to work on the Pectoralis Minor.
Sorry.
That's okay.
Getting over a head cold.
Okay.
All right, yeah, you have to let me get used to that.
Okay.
Okay. I'm not going to stop laughing.
Good. Actually, when I access the fascia, some people get very quiet. Some people have even cried a little bit.
I've had a release like that in a different area,
Okay.
but here I can only laugh. Oh my God. I hope this makes Rolfing fun for everybody who's watching.
Good, almost done. Last time.
It's going to be impossible for anybody not to laugh.
And thank you.
Oh God.
Sometimes you might be wondering, why is he doing the same movement over and over again? I like to see if the movements we've done in the armpit, in the back of your body, the front of your body, have actually made things better for the arm, which for me is about lengthening this arm as much as possible. And so far, that feels even better than before. Just going all the way down to the bottom of the C, to the fascial level, and slowly going down to the wrist. Good. One of the last things we do on the right or left side of the body is to work underneath the rib cage. Wherever there are bones, there is fascia, there's connective tissue. So what I'm going to do now is to ask, I apologize, Deborah.
No, don't apologize. I warned you.
Is I'm going to go right underneath Deborah's ribs, and I'm going to ask her to take a nice deep inhale. And as I do, I'm kind of going underneath the ribs and waiting for the exhale. And then she's going to inhale again as I go back into the ribs and exhale. And again. And exhale. 2 more times. Inhale and exhale. And then last time. Inhale and exhale. Now you're going to take a couple of deep breaths. And after those deep breaths, I want you to slowly come off the table. And we're going to walk a couple of times. And I'm going to look at how the left side of your upper body is doing compared to the right side. So what we're going to do right now is to walk towards the door. I'm going to look at your left side and see how your arm is swinging compared to the right side. And I want you to look forward and let's take a walk.
My ankles snap, crackle, and pop. Been doing it since I was a kid. No amount of Rolfing has ever changed that. I'm cold.
And so if you take a nice inhale towards the door, what is your sensation? Is it about the same on both sides?
No, this side feels looser.
Okay, feels a little bit looser.
Yeah. It's a little hard because I'm chilly, so
okay.
The next time I walk,
Okay, so we're going to come over here, and one thing I'm going to do is to look at your range of motion. So you're going to start right here, and I want you to slowly come up to about right here, and come on back down. And on the count of 3, I want you to slowly come up. Good, and come back down. And again. Good. What I'm trying to do right now is to find any parts of the ribs and the cartilage between the ribs that might be tight. And there are some spots right above the chest which are a little tight. So that's something to look at the conclusion of this session, and if not, definitely the Rolf session 3.
Okay.
So I'm going to have you back on the table. Now we're going to work on the right side of Debo's body. Debo was telling us
Thank you.
earlier
I was about to correct you.
that there was some pain in the back part of her shoulder next to her bra.
Um, so it's actually at brow level, but it's closer to the spine. It's a little bit on the right side, but it's
Okay.
closer to the spine than the shoulder.
And also you were talking about a soreness in your wrist as well.
Right, because that's my, I've never had or been diagnosed with carpal tunnel, but if I were, that would be the wrist that would have it.
Okay. So I'm going to be mindful of that and tell me if my pressure is too little or
I
too
will.
much. So we're going to start at the elbow, go all the way down to the level of the fascia. And when I do, then we'll slowly go towards the wrist. So what I'm feeling already is that it's taking me a little bit longer
Mm-hmm.
to get to the fascial layer. That's why I'm a little bit slower in going to the wrist.
Yeah, I don't feel the same kind of movement I did really when you were on the left side. I felt it right away. I felt it moving under the pressure that you were giving it. But on this side, I don't really feel any movement. It's kind of amazing the level of body awareness that one gets when they get Rolfed, or at least that I got when I got Rolfed. I feel more movement now.
So I'm going to make another pass. And as you were saying, it is taking a little bit longer, and you don't necessarily feel the movement like you did in the left arm as you did on this side, which is your right arm. You only were feeling the movement when we approached the wrist.
Right. Now I'm starting to feel it more now,
Okay.
in the upper area, but that first pass on my left arm, I felt it right away on the first pass, and I didn't feel it right away on the first pass on my right arm. So it's definitely a noticeable difference.
Good. And I want to thank you for communicating that with us, that as we go to our third pass, that you're starting to feel even more movement closer to the elbow now
Yes.
than the first two passes. And it's also easier for me to sink into your fascia as I approach your wrist.
Yeah.
Can you tell me again when you experience the most pain in your right wrist?
Um, well, it's when I'm working out and doing push-ups.
Okay. And so the most pain is after or during or after a workout?
Well, I mean, it would be during the workout if I didn't use the dumbbell handles. Whenever I do like a plank or a push-up where I'm on my hands directly on the floor, then yes, it bothers me a lot. And so I don't do that.
I thank you for making that modification
Yeah.
at the gym. Can you tell me, as you extend your fingers, which side is a little bit tighter, the palm towards your thumb or towards your little finger?
The palm towards my thumb.
Yes.
Like on the other side, but a lot more this side. I really feel it.
Okay, so you're feeling more tightness on the
Yes.
palm by your thumb. So, like we did on the other side, we're going to work on that line between the palm closest to your thumb and your outer elbow. Again, as Dr. Rolf said, taking the tissue where it needs to go and calling for movement. And like the other side, there's symmetry on the right side, meaning that there's no excess pronation or supination when your palm is facing the ceiling. And on this side, I feel it's a little bit tighter to get into those fascial layers. And it's through your movement that we're able to kind of smooth out the tightness. So in a 60-minute session, I might do 3 to 5 passes between the wrists and the elbow. Now I'm starting to experience a little bit even more tightness right in the middle of the forearm. Still moving the fingers, trying to lengthen that part of her body from the elbow to the wrist. And I'm wondering, Debo, if I am triggering any pain in your wrist as I bend your fingers.
No, you're not triggering any pain, but I can definitely feel that this is a lot tighter. Oh, that movement.
So the movement that you felt were different muscles that were on top of one another.
Right,
and I'm
right.
almost like clearing a path
Right.
so that the muscles move more, glide easier.
Feels good. So some people might call that pain, but I call that like just a good deep tissue feeling, you know?
And now I'm going to redo the test and ask you to lengthen your fingers a couple of times along your palms, along the pinky side and the thumb side, and I'd like you to tell me how the pressure is by the thumb.
It's like a world of difference.
Okay. So it just took about 3 or 4
Yeah.
iterations from the wrist to the elbow, thank you, to loosen up the front side, and this will hopefully make the pressure going into Debo's forearm even easier. And already I'm starting to feel the ease of accessing your fascia. So I notice a little bit of tightness in the as I approach the wrist.
Mm-hmm.
Do you also feel that?
Yeah, and I did feel a little of that discomfort that you refer to.
Okay, so there still is a slight discomfort or sizable discomfort as I approach the wrist. Okay. So what I'll do is I'll just go back to that area where there is the tightness, but on the other side,
Right.
and call for movement. So I feel it right
Yep.
about 2 inches from your
It's where I feel
wrist.
it too.
Just one more time after this. Okay. Last time going by the wrist. Actually feels much better.
It does. It's
Okay.
you know, a little bit of the discomfort, I guess is a good word for it. Feeling was there, but it was more sharp the first time, and the last time it was a lot duller and less discomforting.
Good. So just those couple of passes that we did made that discomfort from a sharper level to a more of a duller
Yeah.
level. Thank you. Again, I'm up following the path of space between the bicep and tricep, trying to feel for any fascial adhesions.
Now I feel this all the way down into my fingers,
Okay.
which, interestingly, I don't think I felt it that way on my left side.
So we do have a nerve called the brachial nerve, which starts out in the upper back and traverses all the way down the shoulder to the wrist. So you might be feeling that.
Ah, okay.
So it's getting smoother and smoother each time
Yeah.
we make a path along that space. What I'm also doing is I'm starting at the shoulder, and if there's any hint of internal rotation, I'm taking that internal rotation away and kind of pinning that shoulder back to the table so we can open up the chest, and that'll give us a better time to breathe or a better breath. And thank you. The next step is our dual operator, where I will be working with both the cartilage between the ribs and the middle to upper back. So again, I'm going to place my hand right next to Devil's spine.
There's no mole on this side.
Okay, good. Thank you. And I'm going to place my fingers right on Devil's sternum. And as Devil takes a nice inhale, I can feel the cartilage between her ribs. And then as she exhales, I'm pulling all the muscles from the deep erector spinae, rhomboids, all the way to the medial border of the scapula, away from that midline of the spine. So she's going to take another inhale and exhale. And it's almost like I'm pulling Devil's scapula away from her spine. And 2 more times. Take a nice inhale. Now, Devil, is that me, or is there a little bit more tightness on the right side?
Tightness.
Okay. So you do confirm there's more tightness on the right side,
Yes.
in between the ribs. And I will say that the back feels pretty smooth, except for right before the medial border. We're just going to go one more time. You're going to take a nice inhale. I'm going to go right underneath the clavicle, and then you're going to exhale. Good. And since I have you here, right by the rhomboids, just like we did on the other side, I'm going to have you to gently take a nice inhale as we go for a jumping jack on our back. And again. Now, I'm not sure about you, but I feel there's a little bit more tightness in your rhomboid on your right side.
Definitely.
Okay, so you do confirm that. Good. So as I'm going up Devil's rhomboid, I'm also taking that shoulder, that rhomboid towards me. And last time, Devil, take a nice inhale. Good. And exhale. Thank you. Now, we're going to work on Devil's sternum primarily. And I'm going to come on the other side. Devil's going to take her hand, her palm facing the ceiling, and we're going to make a sand angel. And whenever you're ready, I want you to slowly come to right there and stop and come back to your hip. Now you're probably asking, why can't Devil go all the way past her shoulder is because I want to access these chest muscles, the pectoralis major muscles, and come back, and not Devil's upper trapezius muscles. So already, Devil, I felt in the beginning, and come on back, right at the sternum, there was a little bit more resistance. And do you feel that resistance?
Yes.
Okay. Ooh, right there.
Yep.
Good. And come on back. We'll just do this a couple more times. Inhale. Good. And exhale. And last time. So I'm making a mental note to myself where there's tightness in Devil's right pectoralis major, and come on back, there's going to be tightness in her right upper back. So I'm going to do a little bit more work on Devil's rhomboid, which I felt was tighter on the right side anyway. So this time, Devil, if it's possible, can I have you turn your head to the right, please? Okay, and now turn to the left and hold it right there. So what I'm attempting, and what I am doing right now is starting it from the spine with my bottom hand, and there is an attachment to the levator scapula, and I'm on the upper medial border, and my intention here is to soften the attachment of that levator scapula. Why? The levator scapula is one of the deepest muscles in the neck. It starts at the occiput, concludes at the upper medial border. And so if you're having any upper back issues, any tight rhomboid muscles, a lot of times it shows up in that distal attachment. So now we're going to do some movement work. So Devil's going to come back with her head, and 2 times she's going to slowly turn her head to the left as we do a sand angel to the right. Good. And come on back. And last time. Good. Come on back. Do you feel a tightness where my fingers are at this distal attachment? Okay. Now I'm going to just give you a heads up notice. I'm going to place my fingers underneath your armpit, underneath the axilla.
All right.
Okay, you ready? All right, so here we go. The first
It's the next one that's really going to make me laugh.
fingers are, thank you for telling me, are at the attachments of the latissimus to the axilla. And actually, there's even better access. I can sink my fingers right into your armpit, and there are no glitches as I take the shoulder different directions. So that makes me happy. Now, okay.
I'm anticipating.
I'm going to slowly. So after laughing, I want you to tell me, does it feel a little bit tighter on the side, or is it just you're just more ticklish?
No, it feels sharp, and the other side didn't feel sharp at all. Oh my God. Get Rolf, everyone. It's fun.
So what I feel, people are asking me, well, Arthur, why are you trying to make Devil laugh? I'm actually trying to see how accessible, how tight the pectoralis minor is, and if it has any effect in taking her hand above her head. And so far, not too much, but I can feel where there's a lot more tightness. And I definitely feel the tightness as I take my fingers and go closer to your neck.
Yeah, and it feels, even though I'm still laughing, it definitely feels like a sharper feeling.
Yes. Sometimes what I do, Debo, at home is I will actually put my thumb of my left hand onto my upper chest, and then I'll take my four fingers of that left hand and go underneath, and I'm almost done. And I will move my hand every which way to kind of like soften those attachments. Okay, I think I've made you laugh enough for a week. So I come back to the shoulder to see if by kind of smoothing out the pectoralis minor, it has any effect on the space between her bicep and tricep. And already I feel it's a lot easier to sink into that space between your bicep and tricep. Why is it important to get rid of fascial adhesions? Because one of the keys to moving is to move effortlessly and with the least amount of pain. When you have the fascial adhesions, you're not moving efficiently. You're moving with more pain and more strain. Again, we Rolf Devil's forearm. And each time we do this, it's easier and easier for me to access the deeper part of her fascia. Still, there's a little tightness on the right wrist.
But I felt the stuff moving. I mean, way better than before.
Thank you. I'm going to place your hand right here. I'm going to work underneath your ribs. So I'm giving you fair warning.
Seems to be mostly the armpit that makes me laugh.
Okay.
And wait to get down to my feet.
Okay. Thank you for telling us we will have a special mic for next time. Okay, so I want you to take a nice inhale. Good, and exhale. And my fingertips are gently underneath Devil's ribs. As she inhales, I kind of push in, and on the exhale, I wait. And inhale, and exhale. And two more times. And last time. And so you're going to breathe just normally, just two times. I'm going to look and see Devil's breath. I'm imagining a wave in the Pacific Ocean in Maui and how it starts a little bit lower than the belly button, the umbilicus, as it traverses the last rib in the front, the seventh rib, all the way to her sternum and into her neck, and then top of forehead. So, since we are here, now it's that time to slowly get off the table, and we're going to look at your walk a couple more times, and then we'll conclude with some hip work. Okay, so as Devil is walking, I'm looking at Devil's contralateral motion on her right side. And what I like about Devil is that when she's walking and even when she's standing, the hands are here. They're not rotated in for medial rotation or external rotation. When you are walking Devil, okay, I'm going to ask you, how is the movement in your right arm versus the left arm?
Yeah, so versus. Okay.
Mm-hmm.
Let me, hang on. Let me do this again.
Okay.
So, my right arm, it still feels tighter than my left.
And where does it feel tight?
Kind of in this area.
Okay.
But I feel it moving more than I did when I was walking before you worked on it.
Okay. One thing we're going to do, I hate to do this,
No.
we're going to stand up one more time, and you're going to face me, and your feet are hip width apart.
It's hard to let my muscles relax when I'm cold.
Okay. Now I apologize for
okay.
the coldness in the room. I would like you to take your feet a little bit wider, hip width apart. Good. Okay. And so what I'm looking at right now is, since she pointed to her tricep and a little bit of the arm in the forearm, if there's any tightness in here. Okay, so that's one of the major muscles that goes to the elbow. And so if it's tight here, I'm also going to look at if there's any tightness in your tricep.
I felt it more here.
Okay, so let's face the camera. So there's a little bit more tightness.
Yeah,
right in
definitely
here.
feel
Okay.
it there.
All right. And since you're getting goosebumps, let's have you on the table, and I'd like you to be on your right side.
On my right side.
Okay. Well, Double warned us that her hips were going to be very sensitive and she was going to be ticklish. And this is the case. Let me give you a cushion for your legs. Okay, let's put a towel over it, a sheet over it.
Thank you.
Okay. All right. So heels are together. The left hip is on top of the right hip. So I'm right now palpating Double's last rib, the 12th rib in the back, and also finding out how much space there is between the last rib and the hip. So if you think she's going to be laughing now, watch this. My goal here is to lengthen the hip away from the rib, because when the hip comes into the rib, we get shortening on the erector spinae right here, and also the quadratus lumborum. So I like to call this the triangle. I place my left elbow and ulna.
The breathing is not discomfort. It's me trying not to laugh, because I know when I laugh, I tighten up. So.
Oh, thank you. And right now I'm on Double's tensor fascia lata.
Holy cow.
And I'm applying very gentle pressure.
Oh.
How does that feel, Double?
It feels fine. It's just so ticklish. It's like everything I can do not to laugh. And I know it's ticklish because it's tight. I know how that works. Oh my God.
So we're going to do some movement, but for like the next 20 seconds, I'm just going to feel the hips, see where it's tight, where it feels good. And again, what I'm trying to do is to give Double a little bit more length in her hip away from the ribs. So we have long muscles in the lower back. And so now what Double is going to do is pretend like there's glue in between the heels, so they're kind of stuck together, and I want you to gently lift and abduct the knee while my pressure is on.
Okay. I'll do my best to keep my feet together.
Okay. And I'll be very gentle to start off with.
Okay, yeah, wait 1 second.
Okay.
Let me get comfortable with your, okay. Okay.
And so I just want you to raise up just 3 or 4 inches. There you go. And come on back. How was that?
It was ticklish.
Okay.
This is the problem with me not getting regular work too.
And again. Good. And come back down. And every single time she comes down, I go more medial towards the spine. I'm right now on the upper gluteal muscles. And again. Good. And come back down. And again. Good. And again. Good. That's a good speed as well. And again. Would you say this pressure is light, moderate, or deep, Debo?
I'd say it's moderate.
Okay. And Debo's doing all the work. I'm just finding out where there might be tight spots and putting my focus there as she does all the work. Good. So right now I'm palpating the greater trochanter of the femur and seeing how easy it is for Debo to come into an anterior tilt and posterior tilt. And the fascia feels wonderful, actually. It's really good.
It's the muscle underneath that's ticklish.
Yes. And so you're the most ticklish.
Yeah. Am I the most ticklish client you've ever had?
No.
Oh, okay.
But you're the most ticklish of all the spots right here. So that's more doing more abduction. So I want you to gently raise the knee again. Good. And come on back. And again. Good. Now, this time, we are going to extend your leg, keeping the knees right on top of one another, okay?
Oh, God. Okay. It tickles so much. Okay. When you're there, just stay there for a minute. Let me get used to you being there before I have to move.
Okay.
Oh, wait. Okay.
Take your time. Now, I'm just curious, did you laugh this much with Lou 10 years ago?
Yes. Oh, my God.
Okay.
I laugh when I get massages, too. But usually I don't let the massage therapist work on my hips because I laugh too much.
I'm curious, do you walk a lot? I know you sit and drive a lot for your work. Do you do a lot of walking?
I used to. My job was walking for like 12 years.
Mm-hmm. 2 more times.
I do try to. I do try to take walks, but walking, and I mean, at work, if I need to talk to somebody whose office is across the way, I don't call them. I get up and walk to their office. But I'm definitely walking a lot less than I used to.
Mm-hmm. Thank you. So what I like about Debo's position is that the heels are together, knees are together, hips are stacked on top of one another. And now I'm going to palpate that last rib again and the hip. And it's actually, we've gotten longer. I'm going to come back.
Okay.
And what I'm feeling, Debo, is that it's easier for me to take my left, not even elbow, it's more the ulna, the dull butter knife, and taking that away from your rib. What is your experience?
Oh, that it's still really ticklish, but I can deal with it a little better, which to me is a sign that you're able to get in there, Because I know the ticklish part is my muscle trying to push you out, I mean, it tightens up, and if I can get past the ticklishness and not tighten up, that's a good sign.
Okay.
It's there, though. Holy cow.
So again, my goal is seeing how easy it is to take Debo into an anterior tilt and posterior tilt. Why? So that when she walks, there are no hitches in your stride. So great anterior tilt, posterior tilt, the only tightness, again, is right here. So it's more gluteus medius. So we have some exercises for you to do at the conclusion of the session. So I want you to come onto the other side. Okay, so we're now on Debo's right side. And like before, heels are together. There's a flex in the knees. The right hip is stacked over the left hip. And I'm now going to do my triangle and see how easy it is to take this hip away from the rib. So I'm just going to palpate.
So interestingly enough, this side is less ticklish. And
Okay.
to me, that's a sign that the muscle is actually even tighter. That, you know, it's when you start to get in there that I get ticklish. So we'll see what happens here.
Okay, so I'm palpating the last rib, the hip, and here we go. So far, a little resistance, but not too bad.
This side, instead of being ticklish, I feel more, you know, I don't want to use the word pain, but because pain is relative, you know?
Yes.
But I feel more sharpness. I feel definitely less tickling discomfort and more closer to pain discomfort.
Thank you.
And again, this is the side that I feel like I have the problems with, and I feel the glutes being tighter. I feel the hip being tighter.
I would agree. It's a little bit harder for me to take my right ulna and take it away from the rib. So what I'd like you to do right now is we're going to pretend like our heels are glued together, and I'm going to have you to abduct, and you're going to gently raise your right knee up. And good, and come back down.
It seems more challenging on this side.
More challenging,
Yeah.
okay. Now take some pressure off, and then you'll come up again. Good. And now I'm slowly going more medial towards Debo's spine as I'm working on her upper gluteal muscles. 2 more times. 1 and 2. Good. So I'm going to palpate the greater trochanter of the femur again. Feel for the anterior tilt and the posterior tilt. So it moves almost as well as the right hip almost moves as well as the left hip. There are some parts of your right hip which are a little bit more, going to be more ticklish or painful. And I'm starting with the sits bones, going right into the gluteus maximus. And do you feel that?
I definitely feel that.
Now, you were saying earlier in our medical intake that you first came to Lou because there were some sciatica issues on your right side.
Yes.
Okay.
I mean, the whole right side, the sciatic issues there and the upper back tension.
Yes, I definitely feel more fascial denseness on the right hip. So what we're going to do is we're going to extend the right leg, and I'll have you do that about 6 times or 5 times. Here we go. You're just going to extend your leg. Good. And come on back. And again. So I find it a little bit harder on this side to go into the fascia. I find a little bit more resistance. And how are we doing, Debo?
Good. I can feel the resistance too. It's not like the Star Wars. This is not the resistance you want.
And just 2 more times.
I
Good.
think you could do that 2 more times and it would feel wonderful.
Okay, let's do it 2 more times.
Okay.
Yes. Thank you for telling me. 1. Good. So something else that I started to do recently is taking the top knee into your chest. So finding where those spots are, I'm going to have you to gently take your knee into your chest.
All the way?
No, just to about right there and come on back. Good. And again. Good. And then if you want to add a degree of difficulty, you're going to take your knee back into your chest, hold it, and now extend your leg.
This is a yoga class.
Yeah. And then come on back. Good. And 2 more times. I know that's a very sore spot. I'm right smack dab in the middle of Devil's right gluteus maximus. Good. And come back. And last time.
It's not, if I breathe, I can work through the discomfort and I can really feel the movement, so it's good.
And last time. Good. Thank you. Now what we're going to do is to check the spacing between the last rib and Devil's right ribs and the hip. The spacing feels a little bit lengthened. And I don't know about you, Devil, but I find it easier to take your hip away from your ribs.
It's less thick, and it's letting you in more, which means I'm feeling more ticklish. So that's a good sign.
That's a good sign. Okay, more ticklish is a good sign.
Yeah, so it goes from not being ticklish at all, feeling some pain and discomfort, to ticklish, to a little bit of discomfort, to feeling relaxed.
Okay, so I'm going to have you to extend your leg just 3 more times, please. Good. The knees are together. Good. And I'm right now on Devil's lower gluteus maximus. I found a little trigger point there.
Oh, yeah. Oh, wow, feel that.
And last time. Good. And thank you. And come on back. So I'm happy because there's good movement in both the anterior tilt and the posterior tilt. We did not take out all of the tightness in the gluteal muscles, but it's a good start. And in every single session, we'll work with the hips. Okay, so I want you to slowly come off the table and let's take a walk. I want you to be mindful of how the hips are moving. So when I saw you moving away from me, I was able to look at your sacrum and I saw more movement in your sacrum.
Yeah, it feels looser. It's mostly on my right side that I felt tightness, so that's mostly where I feel that it's looser.
So in another session, since Devil's right gluteal muscles are tighter, we want to look at also the balancing muscle, which is the psoas major, and that will be primarily Rolf session 5. We will conclude Rolf session 1 with you back on your back, and I'm going to place the original cushion of your head back in its original position, and I'm going to have you lay on your back with your head here. I call this the Shavasana of Rolfing. So we're going to get you comfortable. And what I'm going to do is ask Devil to place her feet on the table. So she's going to put a bend in her feet. And I'm going to place my hand underneath the sheet underneath Debo's hips. So I'm going to ask Debo to gently raise her hips and come back down. Good. And so the width of her feet is the same width as of her knees. And I want to encourage Debo to take nice deep breaths right where her hands are. That's fine. Right underneath her belly button, her umbilicus. Thinking of that nice long wave to ride in Maui, starting where her hands, my hands are. And the end of the inhale is at the crown of her head as she takes a nice long inhale. And the exhale goes all the way down the back of the neck, down each vertebrae to where my hand is at the sacrum. And as Debo inhales, the sacrum expands in my hand. And when she exhales, it comes back down and flattens out on my hand. Good. And just 2 more deep inhales and exhales. Good. Now I'm going to take my hand away from your sacrum, and you don't have to raise your hips at all. And I want you to extend your legs. And I want to say thank you for coming to see me this Monday evening, Debo. I know you have a very busy schedule, and I'm glad I was able to take part of Rolf Session 1 with you.
Me too. Thank you.
Okay.